It's truly an honor to be here today and to represent the QuickStart team at the Princess Margaret Radiation Medicine Program. So, as we all know, whole breast radiotherapy is the standard of care for early cancer breast patients who undergo lumpectomy. And last year alone, in Ontario, 7,000 women was treated with whole breast radiotherapy. The treatment process traditionally requires wait times of anywhere from days to weeks, and this is due to the fact that the treatment process itself involves multiple processes, including CT simulation, treatment planning, quality assurance before the plan can be actually used for delivery. After the patient's initial CT simulation, there's enormous amounts of work that is done to ensure that the plan targets the tumor area while sparing the surrounding normal tissues. So it's not unusual for women to wait anywhere from weeks to a couple of weeks, actually, to even months after seeing their radiation oncologist before starting their radiotherapy. From the point of the view of the patient, the wait time can really increase their anxiety or stress level. To some extent, if there's an extended delay, it can also impact on their risk of survival or local recurrence. The QuickStart program was developed with the goal to decrease the time to treatment for women with early breast cancer. The QuickStart program involves multidisciplinary team contribution so that the patient can start the treatment and undergo the entire treatment process all within one day. Since 2008, Dr. Purdy, our medical physicist, developed an automated planning software that can reproducibly generate a breast plan within a matter of minutes. This really automates many of the manual work that is traditionally done by the radiation planner, now allowing them to complete a plan within an hour. The automated script also generates a summary of all the essential information that is needed for quality assurance. I should mention here that Dr. Purdy was awarded the UHN 2012 Inventor of the Year for this development of the automated planning software. Another attribute of the QuickStart program is the involvement of the clinical specialist radiation therapist, also known as the CSRT role. The CSRT role is an advanced practice radiation therapist role that was developed with support and initiative by the Ministry of Health and Long-Term Care together with CQCO in 2007, with the goals to decrease patient wait time and increase access to care. As part of the QuickStart team, the CSRT is involved in coordinating the care within the process and also patient care and providing support to patients. The CSRT also expedites the process by gathering all the information that is necessary to streamline the process and also adds workflow flexibility for the radiation oncologist as well as the treatment team. The QuickStart process offers patients the same quality and effective treatment without the unnecessary waits. In general, patients are treated within 3 hours after their CT simulation, and that translates to approximately decrease of 11 days in comparison to patients who are treated through the conventional treatment. And all the patients treated through the QuickStart is treated in advance of the CQCO target wait time. QuickStart is also beneficial for patients who had some form of delay during their cancer process, such as, say, delayed recovery from surgery or delayed referral to consultation. And this is because after they see the radiation oncologist, they'll be booked for a treatment CT simulation appointment on that day. And a recent audit of all the patients treated through the QuickStart process in 2013, 31% of the patients actually experienced some form of delay before seeing their radiation oncologist. And through the QuickStart process, they were seen and treated within 2 days after their radiation oncology consult. From the point of view of the patient, having their appointments arranged upfront means that they have decreased anxiety, and many patients noted that having their appointment in hand after they leave the clinic really decrease their anxiety in that they can precisely know when they start radiation and when they finish radiation. For patients with financial burden, it means 11 fewer days away from work. For patients who have a young family or with young children, it means 11 fewer days of their children in daycare or at the babysitter. The QuickStart process is now integrated into the radiation medicine program, and it's offered as a standard treatment option for patients with early breast cancer. The program is expanded, and now we offer it on a bi-weekly basis with future plans to expand this to benefit more patients. The QuickStart process is also cost-effective. For every one patient treated, there's a cost savings of $142. And if we treat 50% of all the patients with early breast cancer through this process, we estimate an annual saving of $42,000. So how can this initiative be translatable to other cancer centers? Well, currently, the automated breast planning software has been adopted and also in routine use at the South Lake Cancer Centre. The software is also being commercialized in collaboration with research technology, and a fully Health Canada approved version will allow other cancer centers to access the same quality automated breast planning software. As well, the CSRT role in Ontario continues to flourish, and right now there are 17 CSRT roles in Ontario practicing in 7 cancer centers. And we foresee that the contribution of the CSRT and the QuickStart team can be transferable to other cancer centers with clear documentation and education. And so we envision that it's possible for other cancer centers to develop QuickStart programs to benefit patients. And if we estimate that 50% of all the women that was treated last year with whole breast radiotherapy was treated through QuickStart process, it's elimination of 11 days for them, an elimination, if we do the calculation of it's approximately 100 years of wait time for them, or a whole century of wait time that is unnecessary for them to worry about radiotherapy. So in conclusion, I just want to, on behalf of my team, thank Ministry of Health and Long-Term Care, CQCO, and also the Radiation Medicine Program for making QuickStart radiotherapy a reality. Thank you.